Have you ever wondered why certain tests get ordered first? Or why same symptom leads to a different panel depending on who you are seeing? Today, I will take you inside the clinical thinking that guides what gets ordered first. Because understanding the priority order helps you have better conversations, ask more targeted questions, and push for what you actually need. Welcome to Opti Labs, where we decode your lab results and reveal the deeper story behind the numbers. I am Dr. Austin Odigie. For most presentations of a general fatigue, illness, or a new complaint, the first thing the doctor orders is a CBC and a CMP. These two together gives an incredibly broad overview of your body. The CBC tells you about red blood cells, white blood cells, and platelets. In a few seconds of looking at these numbers, a doctor can rule in or rule out anemia, infection, immune dysregulation, leukemia, or clotting disorders. It's a powerful screen. The CMP adds the metabolic layer, kidney function, liver health, blood sugar, electrolyte balance, and protein levels. Combined with the CBC, these two panels tell a doctor whether your organs are under stress, whether you have metabolic disease, whether you are fighting something, and whether anything needs urgent attention. These are the tests doctors check first because they catch the most common and most dangerous conditions with the most efficiency. The next tier in a standard workup includes thyroid function and lipids. These aren't emergency tests in most cases, but they are part of a responsible annual checkup for most adults. TSH is ordered because thyroid dysfunction is common, often subtle in presentation, and easily missed without testing. It affects weight, mood, cognition, energy, cardiovascular health, and more. The American Thyroid Association recommends screening starting at 35 and every 5 years after. The lipid panel is ordered for cardiovascular risk assessment. It feeds into risk calculators that estimate your 10-year probability of a major cardiovascular event. That risk assessment then drives decisions about lifestyle interventions, statin therapy, or more advanced testing. When specific symptoms are present, the testing priority shifts. Doctors follow a differential diagnosis approach. They list the most likely causes of your symptoms and order tests that rule in or rule out those possibilities. For fatigue, the first checkup is CBC for anemia, thyroid for hypothyroidism, ferritin for iron stores, and CMP for metabolic or organ issues. If those are normal, the next tier is vitamin D, B12, cortisol, and inflammatory markers. If those are normal, the workup goes deeper into hormones, sleep studies, and other causes. For chest pain or cardiovascular symptoms, first priority is troponin, which is a cardiac-specific protein that rises when heart muscle is damaged. This is the immediate emergency test, then lipid panel, CRP, glucose, and CBC. Then for chronic risk assessment, APOB, homocysteine, and lipoprotein A. For unexplained weight gain, first check is thyroid, then fasting glucose and insulin for metabolic causes. Then cortisol if Cushing's syndrome is a concern. Then sex hormones if the weight is distributed in a specific pattern and associated with hormone symptoms. For joint pain or autoimmune symptoms, CBC and CMP first, then ESRO and CRP for inflammation, then ANA panel for autoimmune screen, then specific antibody panels depending on the suspected diagnosis, and so on. Beyond symptoms, Guidelines recommend certain tests at certain age, regardless of how you feel. In your 20s, the priority is a baseline: CBC, CMP, lipids, glucose, thyroid if you have symptoms. If you're a woman, iron and ferritin due to menstrual losses. In your 30s and 40s, metabolic health becomes the priority. Add fasting insulin, HbA1c, and HSCRP, testosterone or hormone baseline for men, thyroid antibodies if you have any symptoms. In your 50s and 60s, cardiovascular risk becomes the priority: APOB, lipoprotein A, coronary artery calcium score if possible, comprehensive thyroid panel, kidney function trending, bone density for women. In your 70s and beyond, the focus shifts to frailty markers: albumin, prealbumin, and hemoglobin. Kidney and liver function closely. B12, which declines with age and impairs absorption, and continued cardiovascular monitoring. Sometimes the first year comes back normal. This is when the conversation needs to go deeper. And this is where being an active participant in your care matters. If your standard labs are normal, but you feel unwell, it's appropriate to ask, what's the next logical steps given my symptoms? What tests were not included in this panel? Are there specialist consultations that would add value here? You are not challenging your doctor by asking those questions. You are extending the diagnostic process in a collaborative way. In the final video in this series, we are going to tackle a question I get asked the most. How often should you actually check your blood tests? The answer depends on your age, your health status, and what you are monitoring. But there is a framework that makes this clear, and that's what we are going to break down next.